Përshëndetje miq të Dinorios, sot jemi me Marta Anhelush, drejtoreshë e Nutricionit Klinik tek BioCare. Ajo ka ardhur në Shqipëri për një event i cili u mbajt dje, i quajtur The Female Story. Sot me Martën do diskutojmë më tepër rreth sajt, rreth BioCare, rreth produkteve BioCare, rreth shëndetit të gruas dhe këtij eventi që ndodhi dje. Hello Marta, nice to have you here. It's a real pleasure for me personally, and I'm sure the whole audience is going to be listening to us. Yesterday we had a big event, the Female Story, which was quite acclaimed also in the UK as a very successful educational series you held at BioCare. I would like, before jumping into that, know a bit more about you. What sparked the interest in getting to clinical nutrition? How did it all start?
Yes, sure. First of all, thank you so much for inviting me to Albania. It's a real honour and pleasure to be here and to meet doctors and practitioners and nutritionists in Albania. I do travel with my work to different countries, and it's always so inspiring to see how people work and the work that you're doing at Dinorios to help spread the knowledge about BioCare and nutrition and good quality supplements. It's really incredible, so thank you so much. But yes, a little bit about me. Like many people, many health practitioners that I speak to, my journey into nutrition started with a personal one. I guess my health has always been pretty good, but now I know as a nutritionist, good doesn't necessarily mean good, and we often talk about optimal health. But it wasn't really about me, it was when my son was born, and as many babies, children these days, he suffered with some allergies as a young baby. So as most parents do, you look for advice, information, you search for solutions, and unfortunately I didn't find many good solutions in the sort of medical world. Of course there are treatments out there, but there wasn't anything that I was satisfied that would really help my son long term. So that's when I found out about how nutrition and supplements, even for babies, can really help. And actually I got some advice from a professional, a holistic practitioner, and actually the first supplement that I used for my son was a BioCare live bacteria product. It was the baby BioFlora to support his gut health, immunity, and that made a huge difference. And that was alongside some dietary changes later on, change our lifestyle, huge change in our life. And I guess that gave me real confidence and inspiration that nutrition is really powerful. And I couldn't believe in a way that people just don't have that information. People don't know. So that's why I studied nutritional therapy, and it took me 3 years as being a young mum. So it's very intensive, studying biochemistry, physiology, anatomy, and then getting into the depth of nutrition and application of nutrition and lifestyle intervention to improve people's health, to prevent disease, and that included clinical practice as well. So yes, that's how it all started for me some 13 years ago now.
That's truly inspiring, and honestly I can really kind of resonate with that, because I guess that moment when you become a first-time mom, even though you try your best to get advice and read through things, it's never enough, especially with a firstborn, and information out there is sometimes even misleading. So unless you really get in depth of these things, it's a bit hard. Getting to BioCare, how is your experience with BioCare, and being there for quite a while now? What is that sets BioCare apart from the rest in the market? The philosophy, the products, all of it. We're very curious to hear.
Yeah, of course. Well, as I mentioned, my journey with BioCare started early on with using BioCare products for myself, for my family, and seeing fantastic results. And then when I was still studying, we had student clinics, we had to see clients, and we were taught by really experienced nutritional therapists. And I remember a lot of the lecturers use BioCare products. We had a selection of professional brands that we were recommended to check and try. But what I always remember, and some of the lecturers say that, well, there are different formulations out there that may do a similar thing, but the BioCare products really stand out. They really work. And that's how I felt when I tested different products. And sometimes you see the ingredients are similar, you know what it's for, but I always got better results with BioCare. So very soon after I finished my course, there was a job available at BioCare, and it's local to me. And so that was 10 years ago I started working for BioCare. But what really resonates with me, and what our passion is for, and our mission and our purpose really, is to shape a healthier society. And it's a big statement. It's a really important purpose that we have. But everything that we do at BioCare, whether it's creating professional, good quality supplements, educating, advising our customers, it's to make them the healthiest they can be. I'm really passionate about that, because I speak to hundreds of people, and I see that they often struggle with their health for decades. And we have the answers, we have the solutions. They're not always easy, but when you've been suffering with different symptoms for many years, a few months of changes to improve your health quite significantly is incredible. So that's BioCare's purpose. But the way we do that, and the way therefore we formulate our products, is based on this very holistic but very advanced knowledge of nutrition and health, and how the body works. And we've got our own model of health called adaptive health, and it's deeply rooted in the holistic thinking around health and nutrition, but also integrating nutrigenomics, which we've really been talking about and educating and researching for very long, since the research has started really. So adaptive health is around the integration of genetics, looking at how our genetics interact with the environment and the body systems, and those interconnections within those three areas really educate us, and therefore power everything that we do at BioCare. So the way we formulate our products is through this deep understanding of those interconnections.
And here is very important to mention that the quality and the bioactives is key to this. And at BioCare, what you do is excellence is also the excipients. They are, you can say it yourself, that they are at the lowest, the minimum needed for keeping the product up. And another thing that I would really like to commend, because personally I have used your advice ages ago and the clinical nutrition team has always been helpful, and that's really amazing that a company, besides of course the business part, you spend a lot of time and of course resources in helping your customers, that you set up a whole team just helping your customers and then helping the practitioners as well. So that's a big plus, I believe, besides the excellent quality of your products. But going back to you as a professional, what really inspires you to keep all this motivation and this energy and stamina to help your patients, I mean the BioCare patients, and also the practitioners, because of course they know their stuff, but then clinical nutrition is not necessarily part of the curriculum once you do medical school, especially of a certain generation.
Yes, thank you. I'm glad that we have been part of your journey early on as well. So yes, you're right. We have a team of nutritionists at BioCare. So now there are 9 people within my clinical nutrition team. So the advice and the quality of the advice is super important for us, because we have a big range of products, but how we work is in a very personalized way. So we wouldn't advise the same product for the same symptom to different people. It really depends of what's happening in your life and your environment. Maybe sometimes we might make inferences about potential genetic factors involved, or if we talk to a health practitioner, a doctor, they might do testing, and we have knowledge about that to advise as well. So that's deeply rooted at BioCare with a big team who are involved in education, advice, formulation. So we've got the clinical experience, different insights from different people, and actually more widely at BioCare as well, nutrition, clinical nutrition all over. I mean, our managing director is a nutritionist, our head of brand is a nutritionist. So I think that will be common to have a nutrition team for many supplement brands, but I think we've got a big team, and also for that knowledge to be spread across different business departments makes a real difference, because everyone understands the importance of this, and everybody is driven by this purpose that we've got. So of course we are a business and we create products and we sell them across the world, but what's behind it is that compassion.
I would like to ask you as well is, since 2 days ago, now you are in Albania, you really didn't have a chance before the seminar to meet up with practitioners, but yesterday I believe they were very interested to get in touch with you and ask their questions, because many of them has been experiencing firsthand with their patients the use of products. But how did you see their interest, and also the fact that now they are implementing in their protocols supplements, which traditional medicine is not always supportive of?
Yes, absolutely. I mean, it was incredible. You have some incredible practitioners, doctors here. So we had gynecologists, we had pediatricians and pharmacists, lots of other professions there, and I could see I talked to a lot of them and the fantastic work they are doing, and you could see the passion behind what they do. So they have the medical knowledge to diagnose, to treat, to test, and I can see that they're using more tests as well, but then integrating the nutrition and the supplements with that knowledge, and they're having amazing results. And I think there is a deep want for more information to be able to use a wider range of maybe supplements or products, because doctors are more familiar perhaps with the basic vitamins and minerals. Vitamin D is key, and we know in Albania the majority of the population are deficient in vitamin D or magnesium, but also with our understanding more about the nutrition side, hopefully helps the doctors integrate that into their knowledge, and that sort of holistic thinking of thinking widely about how the body systems are working. And for example, yesterday we talk in depth about women's health and problems such as problems with the menstrual cycle, premenstrual syndrome, menopausal symptoms. So there are natural nutrients and botanicals that can help with those symptoms directly, but also it's the thinking of what else is affecting that particular person. So of course we talked about the impact of stress and how they impact our hormones. For another person might be blood glucose and insulin resistance, or for another actually the toxic load that we are all exposed to. So I think what practitioners in Albania can do more of, and I can see the hunger for it, is to think about those interconnections, perhaps target maybe stress or detoxification or inflammation, whatever that might be. And that's what we do very well at BioCare, is having specific complexes that combine different nutrients, botanicals, cofactors together in a complex that has the synergy with the thinking around potential genetic influences, the environmental pressures that people face, and what's happening within the body. So often you will see we don't only use one ingredient, such as chromium for blood glucose balance. We'll combine it with myo-inositol and B vitamins and alpha-lipoic acid. So you have the complete complex in one to target the health issue of your patient.
Yeah, it's really fantastic, these formulations that you target for specific issues, and single ingredient sometimes is not the key. So for instance, inositol on its own, perhaps it will not be delivering or addressing the complexity of the issues our bodies have. So that's really great. And I would also like to mention that, or to point out from your presentation yesterday, which I believe was truly inspiring, was the fact that, besides typical, classic gynecological checks with ultrasound or an MRI or even the blood test, what so far we have not been able to do, in Albania at least, was the genetic part. So to understand certain genes, if they are, they have polymorphisms or anything that is not the properly working a kind of gene, combined with the environmental factors, because these get many times overlooked. And we are stressing quite a bit on this direction. And I mean, I believe we are just following global trends on this. So your understanding of this global trend in shifting more into root cause rather than, okay, let's just use medication to stop the symptoms, but then why are things happening? Why you believe in the last 10 years or so, people are turning more into integrative and preventive medicine?
Well, you mentioned earlier about education for health professionals, and the research evolves all the time, and the research into nutrigenomics has even changed in the last 10 years of me being a practitioner. So we have been learning so much, and that's why the education and constant updates, looking into research is important, because every day is a different day for us. But it is, I think people are turning to new interventions or nutrigenomics because, I mean, we are struggling globally with chronic disease being at its highest, and we simply cannot maintain our healthcare systems. In pretty much every country I speak, the healthcare systems are really struggling. We are in the UK, and there are not enough resources to see everyone, to support everyone, and then people don't get the right support. They don't get enough, and their health suffers. And people are seeing this, not only health professionals, but also people that need that support, and people look for answers. That's our natural instinct, to look for solutions, to look for answers. So that's why I think nutrigenomics is and looking into genetics and testing can be a real game changer and a big influencer, because we can more directly see of what's driving this disease predisposition or pathophysiology for that person, and it can really there's a big drive to personalize health, personalize nutrition, because one fits all kind of medication or interventions, they don't work for many people. So that's a natural progression to have a more personalized approach, and you see that within medicine, we see that within nutrition a lot. So having the knowledge about your individual genetics for us as health professionals can make a difference to what dose we advise, what form of a nutrient. I mean, there is a lot of conversation around methylation, and we at BioCare talk a lot about methylation
and MTHFR as well.
Yes, and there are many genes within the sort of methylation cycles, but MTHFR, methylene tetrahydrofolate, or the COMT gene and enzymes, there is a lot of research done into those and how they impact on our production of methylfolate, and that's why we'd always provide methylfolate in our multi-nutrients or complexes, or the COMT enzyme, which is very impacts our detoxification of estrogen, for example, or many toxins as well, and genetic variants can reduce our ability to do that quite substantially. So there is already quite a lot of research for us to make really good decisions about a lifestyle, but also potentially in this case maybe supplementation.
I would like to touch upon a bit on folic acid, because I believe this is a very important topic, considering my country, Albania. Definitely the majority of pregnant women, and not only children with blood issues, with anemia or other blood complications, they are constantly prescribed folic acid.
Yeah.
And of course, there are better options out there. Would you have a few words on the difference between methylfolate or folate and folic acid?
Yes.
About the acid, I mean the vitamin itself, and also how it the body absorbs it in the different forms.
Yeah. Yes, it's absolutely a very important question, and it's a big topic. And folic acid has been used as a form of folate or vitamin B9 for many years, and there is plenty of research. In particular, you mentioned pregnancy. So folic acid is advised to pregnant women, and often as well for infertility problems as well. It's done tremendous work to reduce the risk of spina bifida or incidence of spina bifida and other congenital disorders. However, now, as I mentioned, with the new research into nutrigenomics and genes such as MTHFR, we know, and again there is good research on this, that some people, I mean everybody, has to, if they they use folic acid, the body has several steps to convert it to methylfolate. So methylfolate, or 5-MTHF, there are different names, is the active form of folate that your cells, your tissues are going to use. So 80% of the folate that you have in your bloodstream is in this form. Plants don't produce folic acid. We don't find folic acid in nature, in foods, or in our bodies naturally. So when we use folic acid as a supplement, the body has to convert it to methylfolate. And this conversion is quite complex. It's several different enzymes, several different steps. But for people who have genetic variants in the genes within the folate cycle, so for example, MTHFR, which we have already talked about, this conversion might be even more difficult. So with certain MTHFR polymorphisms variants, the conversion of folic acids to methylfolate can be reduced from between 30 to 70%.
Which is quite a lot.
And 70%, the end scale, is really significant. And it occurs in a lot of populations. So we are in Albania, in the south of Europe, and most epidemiological research says that south of Europe tends to have a higher rate of this gene variant. Therefore, people here will convert folic acid less efficiently to methylfolate. And that's because naturally in our diet, in your diet here in the south, you used to have more folate present, but we know with dietary changes that has that's different now. And the MTHFR is just one gene within this pathway. There are others like DHFR, MTHFD1. So health professionals who test this will know. So this is why supplementing with methylfolate, not folic acid, is so important, because we're practicing personalized nutrition and we want to provide a body with the optimal levels of nutrients that are easy for the body to use. So methylfolate as a supplement is 3 times more bioavailable than folic acid, which means that yes, it will cross the gut barrier, it will be absorbed very efficiently, but what's more important than the absorption itself is that once it's in the bloodstream, it's active straight away. It'll get into the cells and be used. And for pregnancy complications or miscarriages, it's very common that women who have problems with fertility, miscarriages, or complications within pregnancy may carry these genes. So it's really important that they supplement the right form of folate.
Vaginal microbiome, you mentioned the importance of it, how essential a good microbiome, a healthy microbiome is for us women. Could you please explain, the biodiversity, how antibiotics or antimycotics medications, what kind of impact do they have in our vaginal microbiome? Because of course, not just our gut, but also vagina has its own microbiome.
Yes, absolutely. I think more people now are aware of the gut microbiome. So we have evolved over centuries with bacteria and microorganisms within around us, and we have a big community of microorganisms within our gut that are essential for our health. But what many people don't know yet, or are just finding out about, is that the vagina as well is a rich community of bacteria and different microorganisms that are absolutely essential to keep it healthy and to maintain women's health in particular. It's a slightly different community than in the gut. We don't have as many bacteria and not as much diversity, but a healthy vaginal microbiome should be dominated by lactobacillus species of bacteria. And if we have good levels of these lactobacillus species, and this includes many strains, but clinically we utilize strains such as Lactobacillus gasseri, Lactobacillus crispatus, for example, that are big contributors to the community, keeping it healthy and protective from pathogens. So what they do is within the tissue within the vagina, there are glycogen stores, sort of glucose stores, and the bacteria, the lactobacillus bacteria, use the glycogen to feed, and they convert it to some very important molecule, which is lactic acid. And lactic acid is very acidic, and that's good because that environment should be acidic. It's more acidic than your colon, for example. So the pH of that environment should be around between 3.5 to 4.5. And that's only if you have good levels of these lactobacillus bacteria. If we don't, then we get infections very easily. So it could be various other bacterial infections that are not lactobacillus, or fungal infections such as Candida albicans is the one that's very common. So you get thrush, you get really uncomfortable symptoms, itching, pain, redness. There might be pain during intercourse, for example. But beyond the symptoms, these infections influence our wider health and hormone balance. So it can affect how your hormones are processed, which contributes to all sorts of menstrual dysregulation, to infertility as well, to conditions such as polycystic ovarian syndrome, and even menopausal symptoms. So it's hugely important for women and also for men, because during sex those bacteria will be transmitted to men as well, and vice versa. So the male skin microbiome in this case affects the women. But this delicate balance of bacteria can be very easily disturbed, especially with our chronic use of antibiotics. So commonly we are prescribed antibiotics for all sorts of infections. It could be a cold, a chest infection, and that's very effective often for that. But what people don't realise, that is going to affect absolutely your gut health, but also your vaginal microbiome, and that can also lead to urinary tract infections. So you may have get an antibiotic for a UTI. But what doctors often won't tell you is that the UTI might stem from an imbalance in bacteria within the vagina, because there is a transference, they move around. So actually, there may be times you might have to use an antibiotic, but actually using specific live bacteria probiotic strains that colonize that area of the vagina can be much more effective and give you long-lasting effects and benefit your health in the long term.
Whilst IntraFresh has been present in the Albanian market for 5 years now, a bit of information more, so perhaps our listeners, they all...
Yeah, I'm really excited that Female Biotic has made it to Albania, and already people are using it with great results. So Female Biotic is a live bacteria product containing 10 billion of clinically researched bacteria, but the 10 billion dose is equivalent to 50 billion of standard probiotic products, because we microencapsulate the bacteria, making sure that they are stable, that they survive the harsh environment of the digestive tract, but they reach the vaginal canal where they can colonize and be effective. And we use 4 different strains, including the Lactobacillus gasseri and crispatus, which are really influential, as well as Lactobacillus salivarius, which we combine with cranberry and vitamin B6. And vitamin B6 is really important for hormone regulation, because the changes in our hormones, and that's throughout our menstrual cycle, when estrogen, progesterone, and other hormones go sort of up and down, but also during stages such as pregnancy and perimenopause and postmenopausal stage, where those hormonal changes have a big influence on the vaginal microbiome. So the vitamin B6 helps to regulate that, and cranberry, of course, is rich in phytochemicals that support our urinary tract and help with problems within this area.
And the latest product we have available in Albania is quite a recent product for BioCare. I mean, reformulated product of BioCare is Calm Complex.
Yes.
As well, we've had a fantastic feedback. It's been a couple of weeks, but that's one of those products that you would have results in a day, more or less.
Yeah.
Why is it so effective?
Yes, Calm Complex is a very popular product. We, like, as you mentioned, we have had something similar in the range for many years, but we've slightly tweaked it, reformulated, improved it, and it's become even better. Why it's so effective? We use certain botanicals at really precise, clinically sort of research levels. So especially the lemon balm that we've got in this product, it's at a high 600 milligram dose, and then we combine it with holy basil, with theanine and magnesium, and the magnesium glycinate form. So this combination really works to support the relaxation, the parasympathetic response of the nervous system. So that's your rest and digest mode, which actually not many of us are most of the day. So it promotes relaxation, sleep. So it's very useful at times of stress. And because those herbal botanical extracts are really powerful, they work really quickly on the body.
I have experienced that firsthand, and also customers. They always like, oh, this is so fast working. It's like in a couple of hours you feel a different person.
Yeah, absolutely. That's why it's so popular, because it's very flexible. You can take it anytime during the day if you feel quite overwhelmed and stressed perhaps, and it will have a quick result. Or many people take it in the evening, because often you come back from work, you're quite wired and tired as well, but then you can't sleep.
Yes.
And sleep is so vital, and that sort of cycle continues, day by day. If you don't sleep well, then you're tired in the day. You have more sugar, carbohydrate, more coffee, and that affects your health in many ways. So you can take Calm Complex in the evening to relax and sleep better, and naturally your energy will improve, your focus, your memory will improve, and also, because we talked about the interconnections between body systems, it may be that your menstrual cycle improves, or it may be that your performance in the gym, or you can exercise more, or you actually lose weight more easily. All sorts of things can happen if we manage stress in our lives.
And finally, as a clinical nutritionist, what your recommendations would be for our Albanian, let's say, ladies, as our topic this week has been the female story, in terms of lifestyle, in terms of dietary habits, in terms of, anything affecting their life? What could they do to improve their health? Probably simple steps?
Yes. Yeah, that's a good question. One to think about. What is the one thing? Well, I think based on what we've already touched on, seek information. Ask, get advice, and you might contribute to this, but absolutely your ladies in the DINORIOS store, for example, are very knowledgeable and can provide great advice. So being inquisitive, being curious about your own health and your body can make a big difference. And yesterday at the event we talked a lot about living in sync with your hormones, knowing more about your body. So maybe for ladies who are in the reproductive years, sort of tracking your menstrual cycle and your symptoms, and if you're going through perimenopause also. So maybe making some notes. There are the various apps available to track symptoms, and by doing so you can learn more about your body and what it needs. But in terms of nutritional advice, there is so much, but one thing I think we are deficient in so many nutrients, from vitamin D, magnesium, zinc. They're very common. So I think, and I do every day, is taking really good multi-nutrients can really help and can just take the pressure off, because we are just simply lacking in many nutrients, but also the demands on our bodies because of the environment that's polluted, unfortunately, because of the work pressure. We know as ladies we have professional requirements, we have children to take to school, to extra activities.
Busy.
Have to manage so much that simply even a good diet is not enough. So I really see a big difference when you really nourish your body, and a multi-nutrient that's specifically designed for women, like female multi-nutrient, is absolutely great.
Thank you, Marta, so much for your time and for valuable words. I really appreciate, and I hope to see you soon in Tirana.
Yes, I'd love to come again. Thank you so much for having me in Tirana, in Albania, and I hope you found this interview inspiring and informational. So please talk to someone and get advice, and support yourself with the best nutrition you can get.